I'm going to talk tonight about something that I'm very passionate about, and something that affects all of us, because all of us have kids or have grandchildren or are involved in the local community with the youth that we have, and we don't want to see them get injured. And this is really part of a national campaign to help raise awareness about some of the overuse and traumatic injuries we're seeing in our kids and what we can do to hopefully understand it better and prevent these injuries. And I'm going to share with you some data which will probably startle you about the severity of the problem that's out there and what we're seeing in our offices. And this is just a slide here showing two different soccer teams 3 years apart. And the girls on the right have all had to have medical treatment for injuries where they've had to be either hospitalized or have surgery or go to a physician's office because of injuries. So youth sports injuries. It's a big issue right now. There's an epidemic of childhood obesity, and we're, as Dr. Oz says, we're basically eating ourselves to death in this country. So Michelle Obama has championed the Let's Move campaign, which I think is a great thing, and to champion the benefits of activity, healthy lifestyles, sports. And the goal really is to raise a healthier generation of kids, because obesity is really, I think, our #1 major public health, and it's a major fiscal threat to our country right now. With the huge deficit, a lot of what we spend on Medicare goes to treating the consequences of obesity. Diabetes, heart disease, diabetic foot ulcers, problems with problems such as that, hypertension, high cholesterol, all those are affected by obesity. So one of the goals is to really keep people active so that we don't have to spend so much money on that. But there's a paradox that's going on right now. Because of all the pressure from sports and those who are active, we have this epidemic of childhood obesity, but we're also seeing an epidemic of sports injuries in our young people. And there's been a lot of effects of modern sports on our children. There's higher expectations. For those of you who are coaches, you see that kids are doing things that they couldn't do 5 years ago. People that work in Ski Club Vail, they know that the kids are doing tricks that didn't even exist a few years ago. So they're pushing for higher, bigger jumps, faster speeds, higher expectations of what they can do. There's also more specialization. When I was a kid, I played baseball in the summer and spring. Summer was off. I played football in the fall. Winter, I recreationally skied. Now kids are being forced at age 8, 9 to specialize in one sport. They're playing all year round. We don't see it as much here, but in the Southeast, for example, they're playing year-round baseball. And these kids are just basically destroying their bodies because they're overtraining and overusing their bodies. There's more intense coaching and training. We see these camps for kids to get involved. There's pressure from peers, from parents and society to perform at higher levels. And there's a quote that's probably appropriate in many cases, where kids are really being used as pawns in a parent's game in some circumstances. And there's also this pressure to win. This is a video here from University of New Mexico, played BYU in a soccer game last year. And this is one of the athletes, and this was not picked up. This was not picked up during the game. None of these actions were picked up until afterwards when they reviewed the video. This is the same athlete. The pressure to win at all costs here is kind of demonstrated here. This one's kind of the most gruesome one of all. So, it's in all levels of sport, and she's pretty intense. So there's significant pressure, and I think it's not just for the athletes. The parents in many cases have gone from supportive fans to really disruptive influences. We see pressure like Freddie Adu here, named to the national team at age 13, signed a Nike contract. And that's a lot of pressure on a 12 or 13-year-old kid trying to figure out what to do. Coaches and referees, in many cases, have quit due to parental pressure. And when we were in Boston, we had this case, Thomas Junta, who actually murdered another parent at the hockey game because he was upset that his son wasn't playing. There's extreme examples like this which we use to highlight the point, but this is something that we see. All of you have been at games where you see parents who are getting out of control with little kids that are this big playing a game that's supposed to be fun. And why? You ask, why does this happen? Well, sports, in many cases, they become a vehicle. This is the movie from the blind side, where it can be a ticket to a better life. And scholarships may hinge on an athlete's skill. There's celebrity status for our high-level athletes. And there's also the financial aspects of it too. If you can make it to these elite levels, there are financial aspects of it. But the issue that many of us don't realize is that it's a super steep pyramid. And there's lots of kids that play Little League baseball. There's fewer kids that play high school baseball. There's fewer kids that play college baseball. And there's very few kids that make it even to the professional level. And then the Major League Baseball level, it's so rare for somebody to make it to that level. But if they do it, there's huge benefits that can occur to them. So we're seeing increasing injuries in our children. These are all kids I've taken care of. This is a kid who came in on Halloween here with a sore shoulder, probably from putting his stripes on. This is my nephew in the middle there. I think he had a hot dog in his glove. But we are seeing increasing injuries in our children. Just today, as I mentioned, I saw 5 high school girls, all who've had surgery in the last 3 months. From our community, I saw another kid who was in gymnastics and got a concussion and hurt his shoulder. So it's happening right in our community. And this leads me to the data here from the Sports Trauma and Overuse Prevention Program, which is really a national injury campaign. And this really started because people started recognizing that there was an epidemic of preventable, and that's really the key word, is that we can actually do something about it, youth sports injuries. And organizations and different corporations started to come together and say, we need to do something about this so that we can teach parents, coaches, athletes, and healthcare providers about the problem so that we can understand it better and hopefully prevent injuries. And the campaign really focuses on youth sports. It initially started off with 12 sports. Now it's up to over 21 sports, where they've tried to take the best available data and compile it and say, all right, what are the major causes of injury in these sports, and how can we prevent them? These are the organizations that came together. There's a number of sports medicine organizations, pediatrics, orthopedic surgeons, youth sports like Little League, professional leagues, medical institutions like the Cleveland Clinic. Our clinic has come with this, Vail Medical Center, the Youth Foundation. We've done some talks at WECMERD here. So we're trying to get this into a grassroots effort to really tell people about this problem, make them aware of it so that we can hopefully improve our outcomes for our kids.